Hello, I'm Dr. Trevor Wilde. I'm a board-certified family medicine physician practicing in Grand Peaks in St. Anthony, Idaho. I also have the opportunity to deliver babies at Madison Memorial Hospital. One of my passions is working with children. I love it. Our children are so important, and making sure that they have a healthy and productive life is part of what we're engaged in as parents. Today I wanted to do a brief overview on well child checks, or regular visits that are conducted to help take care of your children's well-being. So let's go ahead and get started. What is the reason for well child checks or regular visits for your child? By having regular scheduled doctor's appointments at certain ages, we are able to evaluate how your child is growing and developing physically, mentally, and emotionally. We are also able to identify any concerns that may be present that are common to your child's age and development, while offering evidence-based recommendations to help you in your efforts to raise healthy and happy children. What is the normal frequency of well child visits? From age newborn to 2 years old, we'll initially start out seeing your child every 2 weeks to 2 months for the first 1 year of life. Then, every 3 to 6 months until 2 years old. At 2 years old, up until 18 years of age, we'll often only see your child once a year for their regularly scheduled well child exam. But of course, if there are any needs that arise in between that time, we're happy to step in and help out. So what is the focus of the history and exam by age? From age newborn to 2 years old, primarily we're focused on your child's growth in weight, height, head growth, and evaluating for any previously undetected diseases or conditions. Regularly scheduled immunizations are an important part of these visits for those choosing to immunize their children against potentially devastating diseases. From age 2 to 5 years old, the majority of this exam will be focused on evaluating how your child is developing emotionally, mentally, and socially. Typically, no immunizations outside of routine flu vaccinations or otherwise are required until your child prepares to enter kindergarten. What are the age-based focus of well child examinations at slightly older ages? Well, from age 5 to 10, we are primarily focusing on your child's success at school and any complications or difficulties noted during this time that might indicate underlying conditions. We are also monitoring the physical changes occurring as they enter or prepare to enter puberty, and updating immunizations as needed. From age 10 to 12, much of the history and exam is focused on the physical changes that are occurring, as well as evaluating your child for any emotional or social difficulties they may be having. This is a time when peer pressure typically begins, and screening for risk for drug use or misuse, as well as other social problems, is also important. From ages 12 to 16, your child continues to mature and now is entering puberty. The exam is important to recognize any differences from the normal development pattern of puberty, but is also very important for the provider to evaluate for concerns with drug abuse, sexual activity, and eating disorders or depression. Some immunization boosters will be given during this time. Age 16 to 18 years old, they're reaching that point. They're almost 18 years old and almost adults. Your child is gaining independence in their decision-making and looking toward the future. In this, they are also developing more personal and emotionally intimate relationships with others. Screening for drug abuse, alcohol use, sexual activity, and depression can be critical at this time. A focus on transitioning into adulthood is also an important part of the visits during this age. There's great things that are going to happen for your child. We want to make sure that they continue to be able to progress forward in this journey to adulthood. Thank you so much for taking the time to review this overview of your child's well child exams. Additional information will be posted concerning immunizations for those who may have concerns or want to learn additional information. We will also have additional information concerning the specific details, milestones, or goals and accomplishments that we expect at certain ages for your child. These will be posted to the website in a sequential pattern. Please stay tuned and come and visit us at Grand Peaks. We're happy to help you in this journey with your child. Thank you.